Hi, I'm John Bundrick,
And I'm Shannon Ortman.
and today we're going to demonstrate how to properly instruct a patient in how to use a walker. So today our patient is a 67-year-old female, status post 5 days, left hip fracture. Today we chose the walker because it provides a greater base of support and more stability as opposed to crutches. So basically what you're going to do is, in order to fit the walker, you'll have your patient stand up and observe where the handlebars are, and they should be about at the greater trochanter level. If you need to make any adjustments, you can just turn it upside down, and there is a little button here on each leg, and press it in and just make your adjustments appropriately. And in order to store and transport the walker, you can fold it, so there are buttons on each side you can press, fold it up, and you're ready to transport it or store it in your closet. And whenever you get ready to use it, just unfold it and make sure both of them lock in place. Next, we're going to go ahead and demonstrate how to sit to stand, and we're going to demonstrate an appropriate gait pattern and how to walk with it, and then we're going to do stand to sit. First, you're going to want to make sure the wheelchair is locked for safety purposes, and then you're going to apply the gait belt, and this is just so you can have some stability whenever you're guiding your patient. So I might have you lift your arms up for me. Then you'll stick it through the teeth first, and then make sure it's nice and snug, but not too tight. And then once it's fit appropriately, you'll go ahead and tuck the loose part in. And now Shannon's going to demonstrate transfers.
Alright, so before I get her standing, I'm just going to show you guys really quick how we're going to do our walk. So we're doing a modified 3-point gait since she is partial weight bearing. So the first thing you're going to do is, once you're up and you have the walker fitted correctly, you're just going to slide it on forward, step with your affected side, and then continue with your unaffected. So you slide it forward, affected, unaffected. So that's a modified 3-point gait. So before I get her up, I'm going to swing these foot pedals out of the way, just so there's nothing in the way that could trip her or anything. Once again, just making sure the wheelchair is locked, just for added precautions. Alright, and then I would just place the walker up in front of her. John's going to hold the wheelchair for me, just for another little stability there. And then the first thing I'm going to tell her is that I just want her to scoot to the edge of the chair a little bit. And then, do you feel dizzy at all? Because she does have low blood pressure, so we want to make sure she doesn't feel dizzy. Are you okay?
Yes.
Okay, so the first thing you're going to do is you're going to put your hands on each of these armrests. I'm going to grab hold of her gait belt, and we're going to say on 3, we're going to stand up. So on 3, you're just going to lean forward and stand up, and I want you to grab with one arm on the walker and then the other once you're standing, okay?
Okay.
All right, so 1, 2, 3, stand, and then grab 1, 2. All right, do you feel stable, dizzy, or anything?
No.
Okay, perfect. So the next thing we're going to do is, while I have my hand on the gait belt, like providing the stability she needs, I'm just going to instruct her to slide the walker forward, and then step with her her affected leg, and then unaffected. Good. And then we're just going to take a couple steps just to demonstrate. Okay, and next we're going to turn around because we want to actually go back to the chair and sit. So the first thing we're going to do is we're going to tell them to turn towards their unaffected side. So they can have that stability. As time progresses, we're going to have them turn towards the affected as well, just to get some practice. But for right now, we're going to turn to the right. So we're going to do little movements here. Good. And then we're going to take one step forward. Good. And then we're going to turn again. Alright, and then when they get to the backing up stage here, we're going to make sure that they feel the back of their knees touching the back of the wheelchair before they do anything. And she's touching the back of the wheelchair now, so then we would instruct the patient to reach back and grab those armrests, but make sure you see them first. So reach back with one, and then the other, and then slowly lower down. Alright, so that's how we would teach a patient to use a wheelchair or a walker, and then getting up, walking, turning back around, and sitting down.